COVID-19 has changed how America sees healthcare workers. They're no longer just doctors, nurses, and staff. They are frontline heroes to be celebrated. And our next guest is a registered nurse, Margo Buda. She's recently received recognition in the form of a national award. How are you this morning?
I'm doing great. Thanks for having me on your show.
Good to have you, and thank you for the work that you've been doing. So let's start off by talking about this award. It's the Ceca Award. Am I pronouncing that correctly? What is it?
Ceca.
Ceca. All right. So what is it, and how did you become the recipient of this?
So I'm a registered nurse at Knollwood. It's a military facility for retired military officers and retired government officials in D.C. And I was part of a team that really fought to make sure that COVID did not affect our residents, our staff. So we worked really hard to do that.
That is.
And I also, yeah, go ahead.
That is no small task, because we saw how COVID ravaged a lot of retirement and nursing facilities. How were you able to do that, especially, when the virus first hit?
So we coordinated every day with Zoom meetings, and all the directors spoke with each other and updated each other with what was going on in their area in the facility. We also spearheaded a collection of rooms for COVID-19 residents if they did become positive, so we could properly care for them. We also ramped it up testing and made sure that everyone was wearing masks and practiced universal safety protocols.
At the same time, you have to do your job, though, Margo. It's got to be terrifying when you're in the position of, saving people's lives, but yet having this virus that you cannot see out there, possibly, becoming this, fatal pandemic in your facility. What was the low point?
So the low point was actually when we first discovered that one of our residents had died from COVID. It wasn't known to us prior that she was ill, and so that was really the low point, and that's what really prompted us that we really had to start testing everybody, start testing residents and staff, contractors, private duties, and prompted us to make sure that we tested weekly our staff members.
And to flip that around, once you saw that the measures that you were taking were starting to have a positive effect, what did that feel like?
It felt great. We felt that we were empowered. Testing was a great tool in our toolbox to fight the mission to make sure that COVID didn't affect any more of our residents or staff.
All right, Margo, we thank you so much for taking the time to talk to us this morning. Congratulations on this award, and thank you for all the hard work you've been doing along with all of our frontline healthcare workers. We really do appreciate it.